Thank you. Our next speaker is Dr. Kirsten Herrick from the Centers for Disease Control and Prevention. Dr. Herrick is a nutritional epidemiologist, and she works in the analysis branch of the National Health and Nutrition Examination Survey, otherwise known as NHANES. Her current work involves assessing nutrient intakes of infants from birth to 24 months and looking at breastfeeding disparities in the U.S. population. Prior to joining NHANES, Dr. Herrick worked in the UK on a number of national surveys that were similar to NHANES. Dr. Herrick's presentation today will describe the data collection strategies and future directions of the NHANES. Dr. Herrick?
Good morning. It's my pleasure to be here and speak with you about NHANES data, National Health and Nutrition Examination Survey. And I will provide just a very brief history and data collection and future directions on the survey, with special attention to the WIC population and the WIC sample in NHANES. Uh-oh, I'm not hitting the right button. So very briefly, I wanted to give you a picture of how NHANES has evolved. And you can see that NHANES has its roots all the way back in the 60s with the National Health Examination Survey. Then it was administered periodically, and we didn't cover the full age range. And in the 70s, we squeezed that important nutrition piece in, and it actually became the National Health and Nutrition Examination Survey. Here again, it's delivered periodically, but we're starting to expand the age range that it covers. And then finally, in 1999, it became the continuous NHANES survey, run every year, and we've expanded the age ranges to include all respondents. So our objective with the National Health and Nutrition Examination Survey is to assess the health and nutritional status of adults and children. And it's really a population-based survey to capture the nation. So our goal, again, is to provide population estimates for health conditions and environmental exposures, awareness, treatment, and control of selected diseases, as well as prescription medication and dietary supplement use, and of course, the all-important nutritional piece, nutrition status and diet behaviors. And this is accomplished through a very complex survey design. We identify counties within the United States and then segments within those counties, moving then further to households, and finally identifying the actual individuals within those households to take part in the study. This produces a population for study that is that's the US civilians, non-institutionalized, and it covers all age ranges, and typically we capture around 5,000 respondents per year, and there are oversamples in particular subgroups. We do oversamples to increase the reliability and have very precise estimates on particular health outcomes. Now here, I want to focus specifically on the oversampling, because this is a question that often comes up with regard to NHANES. As you can see, we've included an oversample for non-Hispanic Black since the continuous NHANES started running in 1999. Also, the low-income white has had an oversample. We've tweaked the oversample for Mexican Americans to sample all Hispanics beginning in 2007. And we also changed the oversample for the older population to just focus on those 80 plus. We no longer have an oversample of young people between the ages of 12 and 19. And then in 2011, we started a non-Hispanic Asian oversample. Not noted in the main table is a supplemental sample of pregnant women and young children. And that's because the survey in the early years didn't have an oversample as described for these other subdomains. When we knocked on a household and found a woman who was pregnant or had young children, then they were invited to participate into the study. But because of other priorities that came along, this particular strategy for including women in this population no longer existed when we got into 2007. And it's important to remember that NHANES is really to provide a national picture of the U.S. And although pregnant women and postpartum women are represented in that sample, it's not really designed to capture sufficient numbers in a single survey year to report on those small subgroups. So we've talked about what NHANES does. What's included in NHANES? Well, there's that in-home interview, and also really the highlight or the star of NHANES, and that is the examination that takes place in the Mobile Exam Center, or the Mech. This is a location where we collect blood and urine samples, we have the all-important dietary interviews, and additional questionnaires. There are also some post-exam components, like the secondary dietary interview that happens about 10 days after the initial Mech visit by phone, and some follow-up questionnaires. So here is the Mech in action. This is at one of our study sites, and it's a combination of 4 tractor trailers that get connected together, and when we set up in a location, they get put together, and this is what it looks like on the inside. This is an example of what the Mech looked like in 2011-12. So you can see we put it all together, and it really does become a mobile exam center that crisscrosses the country. But I also want to highlight, quite literally, these particular components, because it emphasizes the nature of NHANES. It's a survey that does change from year to year, and these particular components were ones that rotated into the survey for that survey cycle for 2011-12. We had specific components that looked at breath testing, muscle strength, we had a dentist in-house, and hearing tests and smell and taste. So these components rotated in, and they are not in the survey right now. And this happens with multiple components from time to time. And NHANES is designed to be modular, to be able to respond to the research needs of the nation, but also to make sure that we can bring things back in so that if we want to measure trends, we can include these in sampling at a later survey cycle. So as you can imagine, getting an NHANES survey to field is quite an undertaking. Typically, we plan about 2 years in advance. So for the 2013-14 cycle, we started planning in 2011, and then in 2012, we started doing a lot of piloting. And for this particular survey cycle, we had to do a lot of piloting for the urine collection. As you might imagine, there's a lot of logistical planning that goes into collecting 24-hour urine samples from participants. We finally figured all that out and went to the field in 2013 and collected data for that survey cycle. And then in 2015, we started doing a lot of data processing, and some of the early data elements come out in 2013, or come out in 2015, and finally in 2016, and everybody gets their hands on the data for analysis. But one of the questions that I'm sure is all on the tips of your tongues is, what about the diet data? And as a nutritionist, I wait for this data as well. So it's important to provide a little bit of background about how the diet data comes out from NHANES. And to do that, I have to tell you a little bit about the working relationship that the National Center for Health Statistics has with USDA. Now, this isn't the USDA of my colleagues that have been here speaking earlier. This is USDA Agricultural Research Service. USDA is a huge organization, and so this is USDA ARS. So what happens? Well, in 2013-14, for example, the survey finishes data collection, and the data comes to NCHS. And immediately, we have all of our coders finish doing all the dietary interviews. So for every food item, for every portion of food that's consumed, there are dedicated codes that need to be implemented, need to be put into the dietary recalls. Once all that's completed, the data is sent over to the USDA. And USDA has a huge task to look at all these recalls and do a lot of different things. The first is they look at all the dietary recalls and identify, are there any new foods? Are there things that our respondents have consumed that aren't represented in the nutrient data bank? If that's the case, then they need to identify what the nutrient composition of these foods are, and that can be done through separate studies, doing lab analyses. Perhaps it's talking to manufacturers and getting information from labels. But there's a lot that goes into updating the nutrient data bank, the nutritional information that backs up the dietary recall. In addition, they look at all the dietary recalls and make sure that they're valid and reliable. And that's an important piece, because without that information, we can't identify the recalls that can then go forward and have produce a reliable and representative sample for the U.S. So USDA does all of this, and they send this information back to the National Center for Health Statistics, at which point we create dietary weights. So there's all of this that's going on behind the scenes after the data has been collected, before we can finally release the data for analysis. And historically, the dietary data is released in the fall, late summer, early fall, a year and a half after the last dietary recall is collected. We'd love to make it faster, but as you can see, there's a lot that goes on to make those dietary recalls come out. So now I want to switch gears and speak a little bit more specifically about the WIC sample in NHANES. Now, I've touched on how we sampled, and I didn't identify a particular subdomain that captures the WIC sample. And that's the way the HANES sample is run. We don't select in on WIC participation. We have age, race, and gender subdomains that allow us to capture a nationally representative sample. So with regards to the WIC sample that appears in HANES, that's based on a national sampling frame. These are the individuals that are selected to participate into the survey. So what I'd like to do is cover the populations of interest in NHANES: children, infants, and women of childbearing years. So this data comes from a report that I'm sure you're all familiar with, looking at NHANES 2005 through 8, and it identifies the eligible participants between the ages of 1 to 4, and also based on different WIC characteristics. And as you can see from the sample sizes, there are sufficient numbers in NHANES to do analyses based on these individuals. For children, it's not really a problem. We do capture sufficient numbers of children to do an analysis for this group. For infants, it's a little different story, particularly if you want to look at the type of feeding practice, any breastfeeding or formula feeding. So the recommendation here would be you really can't divvy it up based on the type of formula feeding, but you would be able to look at infants by these different 2 age ranges that are important for different feeding practices. The other thing to note is that HANES typically doesn't include women or doesn't include infants in their total nutrients file that have reported consuming breast milk. And the reason for this is because we don't know the volume that they've consumed. You ask a breastfeeding mom, well, you know, how much breast milk did that baby consume in that feed around noon? Mom's going to say, I don't know. Unless she pumped, there's no way to actually get a handle on the volume. And without that volume, we can't marry up nutrient information from breast milk and produce a total nutrients file. But there are ways around this. And one thing that we're starting to do more of is to use the methodology used in the Feeding Infants and Toddlers study to impute volumes of breast milk based on the age of the individual and the total milk consumed either from formula or other sources, mostly formula or from breast milk, and impute a volume that we can then use the rest of their nutritional information and create a total nutrients file. Now, in this way, you'd actually be able to include all infants, not only those who don't report any breast milk. Finally, let's talk about women. Now, as you can see, the numbers in these subcells get quite small. And unfortunately, there's no way to go back in and boost the number of women that we've captured in this sample. And based on our priorities going forward in NHANES, there's no way at the current time to boost our samples either. I can say that it's true that the proportion of pregnant women in NHANES are likely representative of those women in the population. At any given time in the US population, really there's a small number of women who are pregnant or breastfeeding. So our national sample does represent this. And the reason we don't have more women, as I've mentioned, is because we have other priorities for oversampling different subgroups. And pregnant women in particular cause a problem when we come to NHANES because they often aren't eligible for many of the components in NHANES. And for that reason, we would have to boost the sample of the rest of the population to provide an adequate sample of women who were in the postpartum period. So what does this mean going forward? Short-term solutions for analysis for this committee. Well, for children, I know it's not going to be popular, but I would recommend that if there's any way you can wait until the 13-14 data comes out, that would be a great idea. Typically in HANES, because of the modular nature, not only because of the components, but also because we have, because it's run every 2 years, the survey is designed to be merged over many different years. The survey recognizes that to get adequate sample sizes of particular subgroups that you may be interested in, you have to be able to merge, and you need to be able to merge. For a lot of the dietary analyses, we like to merge over a minimum of 4 years. That's simply the way the survey was designed. I can say that I have had a sneak peek at the merged data set of 2011 through 14, and can say that for children, you're looking at a similar number of children that you saw in the sample of 2005 through 2008. So that's good news for children. It would provide a great before and after the WIC package change was implemented to really look at the impact. Now for infants, I would say consider imputing the breast milk volumes to increase the number of infants that you have in your sample, and again, waiting for that 13-14 data to come out. Unfortunately for women, I have no solutions. I can't go back and collect any more data on that. But I can say that moving forward, there are opportunities. Future directions. Well, as I've mentioned before, NHANES is committed to the Asian oversample. Because we have that oversample, it's difficult to put in oversamples for example, women of childbearing years. But there are opportunities. There would be a possibility to consider funding a separate study to boost the numbers of pregnant postpartum women and infants and their children. And of course, it all comes down to money. And that is, NHANES is funded about 2/3 by internal funding, but 1/3 actually comes from a significant number of our collaborators. Here's a list of around 25 partners that provide funding for HANES. And to give you a few examples of the types of things that our collaborators fund, one of particular import to the WIC population is red blood cell folate and serum folate. That's funded by the National Center for Birth Defects and Developmental Disabilities. So for the women between the ages of 15 to 44, those blood samples, that annual cost is around $200,000 per year. But I have another model for you to consider, and that is the NHANES National Youth Fitness Survey. This was a survey that was done in 2012, and it's a great model to take forward if you wanted to look at women and children in the NHANES population. This survey was funded by monies from the Affordable Care Act. We sampled 1,500 youth between the ages of 3 and 15, and it funded a 5th NHANES trailer that we outfitted and had travel around with the rest of the Mech trailers. The approximate cost was around $6 million over 3 years, the bulk of that coming in the second year. There are some other examples of HANES collaborating with industry. For example, Eli Lilly supported measures for the DEXA, some measures for the DEXA, and Pfizer supported some questions regarding erectile dysfunction. But I do have to stress that there are no proprietary rights for any funders that provide money to go forward in doing any of these components or other aspects of the survey. When the data is released, it's released for everyone. So if we were to look at the NNYFS as a model for going forward with a study for women and children. The objective for the NNYFS was to look at exercise and nutritional habits of youth in the US through interviews and fitness tests. We had data collection only in 2012, boys and girls between the ages of 3 and 15, and it was a separate sample from NHANES. So there's a separately designed sample from NHANES. There were no overlapping households. They just traveled along to the same 15 stands. There we go. So there were fitness measures that were included in NHANES and NNYFS that were the same. Body measures, physical activity monitors, the 24-hour recall, although there was only one collected in NNYFS, physical activity questionnaires, and then upper body muscle strength. Differences were cardiovascular fitness, gross motor development, plank, so that's physically supporting your body elevated above the ground, upper body muscle strength, and lower body muscle strength. And these were new components to NHANES, which really describes why we needed to have that fifth trailer. This is a look at what was in exam room 1 of the fifth trailer. Here's a look at exam room 2 and the ever-popular dietary recall. So what would it look like? An NHANES mother and child study? Goal might be just to boost the number of selected subgroups to produce reliable and precise estimates, focusing on infants between the ages of 0 to 11 months, pregnant women and postpartum women. It could be modeled on NHANES, so collecting a lot of the same data that we already collect on anthropometry, the dietary interview, questionnaires, and laboratory. And it really provides an opportunity. You can utilize the field operation infrastructure that's already in place with NHANES. And it's an opportunity to collect novel data. As a nutritionist working in this field, I can't express to you how exciting it would be to have data on mother-child pairs. Think of the things that you could look at with respect to diet, or anthropometry, or maybe other aspects. There could be additional biomarkers, or even breast milk samples. It's certainly an opportunity and something to consider moving forward if you want to be able to look at this population within NHANES data. But the realities of a focus study, it's not cheap. We'd need that fifth trailer. We unfortunately can't ask the current Mech to do a double duty and do a separate study. We learned that from doing the NNYFS. All the respondents in the boost sample would have to go through that fifth trailer only. So anything that you wanted to do would have to be collected in that fifth trailer. It's possible that we could ask the laboratory within the Mech to run some of the samples, but there are other options too. We have a Mech mobile lab in a van that could also be used. Cost, I couldn't speculate. All I can say is that for NNYFS, for that additional 1,500 children, it was around $6 million. Time frame, got to start now for planning the 2019-2020 sample. So, for example, we're already starting to do a lot of the planning for that 2019-2020 survey. Letters of intent are already coming in, proposals, and then pilot testing of any new things will start to happen soon. Pilot testing doesn't need to be done unless it's something like an examination, something that's going to need some logistical know-how going in. Any survey components that have already been validated don't need to be pilot tested. But then there's a lot of work that goes into translating manuals, doing training, outreach materials, and things of that nature. If you were interested in submitting a proposal, you can find it on our HANES website. Information about submitting those proposals is here, and that comes to NCHS, and we review all of the sections and identify whether or not there's sufficient scientific merit to go forward, whether it's appropriate, provides public health significance, and of course, that important piece, there needs to be financial support for any changes to the HANES survey. So I hope I've provided a very brief background on NHANES, given you some insight into how the sample is derived and what are our thoughts going forward. I understand there may be some questions regarding NHANES, and I'm happy to take anything now.